day everyone, and welcome to my video discussion for today. I am Laika Lanch Ayuban, your instructor, and today we will talk about pregnancy diet and pregnancy and exercise. So, what is pregnancy diet? Okay, your diet during pregnancy helps to support your own well-being and supplies the nutrition your baby needs to develop and grow. As a general guide, pregnant mothers needs to eat a healthy diet, high in nutrients and low in sugar, salt, and saturated fats. It's normal for pregnant mother to gain weight. However, gaining too much or too little weight increases the risk of complications for you and your baby. A healthy pregnancy diet should be much the same as your typical healthy diet, only with 340 to 450 additional calories per day. Aim for a healthy mix of foods including: first, complex carbohydrate. Complex carbohydrates foods provide essential fuel for you and your baby during pregnancy. Carbohydrates supplies energy through glucose, plus important vitamins, minerals, and dietary fiber. For a steady energy, try whole grain breads, cereals, wholemeal pasta, and brown rice. Second, protein. Protein is crucial for your baby's growth throughout the pregnancy. Foods like lean meat, seafoods, and eggs are a great source of protein. Third are the vegetables and fruits. When you're pregnant, it is important to eat nutritious food and avoid empty calories. In fact, if you eat mostly junk food during your pregnancy, you may be setting up your baby for a lifelong preference for fat and sugar. According to a 2013 study, fruits and vegetables are filled with nutrients. When you add a variety of them to your diet, you will likely get most of the vitamins, minerals, and fiber that you and your baby need. And there are 6 fruits that is best for pregnant women, which are oranges, mango, avocado, bananas, and berries. And for the vegetables, the best for pregnant women are articles, broccoli, cucumbers, salad greens, squash, corn, and sweet potato. Fourth are grains and legumes. Grains including whole wheat, oats, barley, corn, and rice are packed with minerals such as iron, selenium, and magnesium. There are also especially good sources of the B vitamins, including B1, B2, folate, and niacin. Your growing baby needs for just about every part of their body. Grain supplies energy for your baby's development and help the placenta grow. Lastly, the healthy fats. Health experts recommend keeping total fat intake between 20 and 35% of total calories. Most fats should come from unsaturated sources. Sources of unsaturated fat include fish, vegetable oils, canola, soybean, olive, peanut, sunflower, and sunflower oils, nuts, and flaxseed. All women, including those who are pregnant or breastfeeding, should follow these recommendations. And if you already eat a healthy diet, you'll only need to make slight changes. Fluids, fiber, and iron-rich foods are especially important during pregnancy. Now, let's proceed to vitamins and minerals. Pregnant women require a larger amount of some vitamins and minerals than women who aren't pregnant. Folic acid and zinc are just 2 examples. Once you find out you're pregnant, you may wish to increase your vitamin and mineral intake with the help of supplements. Be sure to read nutrition labels and seek your doctor's advice before using any supplements or over the counter medication. Although rare, taking supplements could result in vitamin toxicity or overdose. However, a complete prenatal vitamin will probably contain a good mix of the nutrients that you need for a healthy pregnancy. According to Stromer in 2020, a woman's health behaviors during pregnancy have lifelong implication for her own health and the health of her child. Yes, I agree, because what the mother does while she is pregnant will be carried by the child until he comes out of his mother's womb. Like, for an instance, the mother always smoked cigarettes constantly during her pregnancy will affect her child's well-being, like when he or she will come out on her mother's womb. There is a big possibility that the baby becomes deaf or blind, and that is because the mother's lifestyle during pregnancy. That is why we should at least be aware to the baby's future, and we need to eat more healthy foods and take a healthy diet for our baby's well-being. And according to Morris in 2020, despite the importance of maintaining a healthy lifestyle during pregnancy, most women do not meet established guidelines for dietary intake or physical activity. And I agree, because some women is not aware about healthy diet and taking exercise during pregnancy, because just like my mom, when she carried me on her womb, she is not aware about this kind of thing, about pregnancy. She eats a lot of meat, a lot of lechon. That is why she got high blood pressure. That is the reason she got eclampsia, and so the doctor said that she needs to take me out from her womb, because if not, I will just die inside her tummy. And also, that is why I became a premature baby. I am only 6 months baby at the time, and I was left in the hospital for 1 month to make sure that I have no complication despite that I was a premature baby. And thankfully that I am normal and healthy right now. Now, according to Lawrence in 2020, pregnancy is a unique phase when women may feel more motivated to improve their diets and physical activity levels, and or experience new barriers to changing behavior. But there is limited understanding of factors that influence diet and physical activity in pregnancy. And I agree, because it is really important to improve our diet when we are pregnant and our physical activity. When it comes to diet, we should limit ourselves to eat harmful foods that can affect the baby's health. Just like I said a while ago, on my mom's experience, she didn't have limitation in eating meats that leads her to experience horrible delivery. Also, when it comes to physical activity, your movement is also limited, and you should be careful when you are exercising. Because just like my cousin, when she is pregnant, she just walk in their village, but she almost have a miscarriage because of walking too much, and that lead her to bed rest. That is why you ask advice from your OB to make sure that you and your baby will be healthy. According to Racho in 2009, evidence that pregnant women in various parts of the world are often forced to abstain from especially nutritious food during such a delicate life stage. And yes, I agree, because some will force themselves to eat those non-nutritious food because they have no choice to eat those, because some women have no enough money to maintain to eat those nutritious food for pregnancy. Also, some women force themselves to eat those food because they have to, even though they know that that is not good for their baby's health. To rush in 2000, antenatal dietary restriction remains a relatively unexplored anthropological puzzle that deserves major academic attention. And I also agree with this citation because there is no evident or proper discussion about the pregnancy diet. That is why some women are not aware about the food that they are eating, because there is such no proper evidence that pregnancy diet are necessary, because what about those pregnant who are bed rest? So that is why we should try to research more about pregnancy diet to make sure that there is no complications if we try it. Now, let's proceed to pregnancy and exercise. Exercise is essential to keeping you fit, relaxed, and ready for labor. Yoga stretches in particular will help you stay limber. It's important not to overdo your stretches. However, as you could risk injury, other good exercises for pregnancy are gentle pilates, walking, and swimming. You may need to modify your current fitness routine to accommodate your changing body and lower energy levels. Work with your healthcare provider or a personal trainer to ensure that you aren't over exerting yourself. According to Bursner in 2015, pregnancy result is in anatomic and physiologic changes that should be considered when prescribing exercise. The most distinct changes during pregnancy are weight gain and a shift in the point of gravity that result in progressive lordosis. I agree because as you can see in pregnant women, they really change physically and even their attitude changes. Pregnant will really gain weight because they are not only one will eat the food but also the baby inside their womb. So having exercises when you are pregnant is a must to do. And when I watch some vlogs from YouTube, if you guys know who is Chris Uy, when she is pregnant to his firstborn, she said that exercising while pregnant is a must to avoid difficulty in giving birth. To Bannerman in 2015, most of the studies addressing fetal response to maternal exercise have focused on fetal heart rate changes and birth weight. Yes, I agree because some mom is very conscious about their weight, and also to improve their heart rate, they decided to do exercise to improve their weight. And just like I said earlier, that to avoid difficulty in giving birth, it is very essential to every pregnant to have physical activity for their baby to have normal delivery and to also have a normal heart rate for moms, because just like my mother, she lacks of physical activity when she was still pregnant. That is why it leads her to have high blood pressure and not normal heart rate. According to Masola and colleagues in 2015, said that exercise has an overall beneficial effect on the body. Aerobic exercise for about 20 to 60 minutes, 2 to 7 times per week during pregnancy is associated with a significantly reduced risk of gestational hypertensive disorder. Overall, gestational hypertension and cesarean delivery. And I agree because just like I said, my mom has lacked on engaging herself in physical activity during her pregnancy. That leads her to harmful delivery to me, because we have 50-50 chance to survive that time, because I'm only 6 months old, because my doctor said that my mom has a high blood pressure and it will lead her to death if I will not go out immediately to her womb. That is why when exercising is important during pregnancy, but you should ask permission first to your OB of what kind of exercise is suitable for you. According to Maloso in 2017, gestational hypertension and preeclampsia are one of the major health complications that cause maternal mortality or morbidity. And I totally agree because this is really what happened to my mother when she was giving birth due to her lack of diet and her lack of exercise. That is why she had a high blood pressure and had to take me out of her womb early so that I won't die inside, because there would be more complication in case that my mom waited longer. So that is why we need to be aware on what we are eating during pregnancy, and we should engage ourselves in physical activity. According to Bonnerman in 2015, pregnancy is an ideal time for behavior modification and adoption of a healthy lifestyle because of increased motivation and frequent access to medical supervision. And yes, I agree, because most pregnant women behave differently when they are pregnant. And this is also the pace where they strive to be healthy for the sake of their child. They really do their best, or they search more about pregnancy in the internet so that they can strive and they can choose what to eat to make their baby healthy. And that is all for my discussion for today. I hope you learned something. Once again, I am Laika Lancia Yuban. Thank you and goodbye.